What is the meaning of hypertension? So the cardiovascular system mainly is composed of heart and the related vessels, and a healthy heart contracts, beats 60 to 100 times per minute in a rhythmic manner. And each time it contracts, there is certain pressure occurring across the walls of the vessel, which creates systolic blood pressure, which is actually the bigger reading on the blood pressure measurements. And during the relaxation phase of the heart, there is diastolic blood pressure, which is smaller reading on the blood pressure measurements. When the blood pressure is exceeding 140 over 90 millimeters mercury in adults, that's hypertension, and it needs to be monitored and treated as well. So the prevalence of the hypertension worldwide is 30 to 45%, and 53.5 of those people are not even aware that they have hypertension. So in order to increase the awareness of the hypertension and related diseases, there on the 17th May, it's pronounced as the World's Hypertension Day. So we have to, even though we don't have hypertension, we have to check our blood pressure regularly. And if we realize that we have increased blood pressure, which is 140 over 90 millimeters mercury, we have to go to the doctor. So why is hypertension important? Because when the vessels and organs are dealing with the increased pressure levels continuously, then there are some structural and functional changes that leads to irreversible and sometimes mortal diseases. For example, heart, eyes, brain, kidneys and vessels are the most pronounced organs which are affected by the hypertension. In heart, we can observe cardiovascular, coronary artery or peripheral artery diseases, heart failures, increased tendency to arrhythmias, heart attacks. In cranium, in brain, we can see strokes, cranial hemorrhages. In eyes, we can see decrease in vision. In kidneys, the decline of renal function, and also some dilatation of vessels such as aortic dilatation. Studies provide evidence that there is direct relationship between hypertension and cardiovascular diseases. Every 20 millimeters mercury in systolic and 10 millimeters mercury in diastolic increase is actually doubling the risk of stroke. Stroke is third leading cause of the death in worldwide, and after coronary artery disease and cancers, unfortunately. So in a patient who presented with the stroke, they were observed that 60% of those patients had the history of hypertension, and 78% of those were with the inadequate blood pressure levels.